Ebola. The name alone can cause fear. But how much do we really understand about this potentially deadly disease? How does Ebola spread? Can it be prevented? Is there a cure? And can your lifestyle make you more vulnerable? In this video, we'll separate the facts from the fear. Ebola disease is a rare but potentially severe viral illness caused by viruses belonging to a group known as ortho-Ebola viruses. Several viruses can cause Ebola disease in humans, including Ebola virus, Sudan virus, and Bundibugyo virus. This distinction matters because vaccines and specific treatments available for one type may not work against another. Ebola has historically had a high fatality rate, but infection does not automatically mean death. Early diagnosis and high-quality medical care can significantly improve a patient's chance of survival. Scientists believe certain fruit bats may play a role as natural hosts of ortho-Ebola viruses, although researchers are still investigating exactly how these viruses persist in nature. The virus can enter human populations following contact with infected wildlife. Once that happens, Ebola can spread from one infected person to another. Ebola does not normally spread like influenza or COVID-19. Transmission generally requires direct contact with the blood or other body fluids of someone who is sick with Ebola. These can include blood, vomit, diarrhea, urine, saliva, breast milk, and semen. Objects contaminated with infected body fluids can also transmit the virus. These may include needles, medical equipment, bedding, and clothing. Importantly, people with Ebola are not considered infectious before symptoms develop. Symptoms usually develop between approximately 2 and 21 days after exposure. The illness may begin suddenly. Early symptoms can include fever, severe tiredness, muscle aches, headache, and sore throat. As the illness progresses, some patients develop vomiting, diarrhea, abdominal pain, and skin rash. Kidney and liver function can also become impaired. Despite Ebola's reputation as a hemorrhagic disease, dramatic bleeding does not occur in every patient. Early Ebola symptoms can resemble other illnesses, including malaria, typhoid fever, and other infections. Symptoms alone, therefore, cannot confirm Ebola. Laboratory testing is necessary. This is why recent travel, possible exposure, and contact history can be extremely important information for healthcare professionals. Ebola can trigger widespread inflammation and affect several organs. Severe vomiting and diarrhea can cause substantial losses of water and essential electrolytes. Blood pressure can fall. Kidney and liver function may deteriorate. The body's normal blood clotting mechanisms may also become disrupted. In severe cases, multiple organs can begin to fail. There isn't one universal treatment for every virus that causes Ebola disease. However, for Ebola virus disease caused specifically by Ebola virus, effective monoclonal antibody treatments are available. These include Ansuvimab, also known as Ibanga, and the antibody combination Inmazeb. But these treatments should not be assumed to work against every type of ortho-Ebola virus. Regardless of the particular virus involved, rapid supportive medical treatment remains extremely important. Supportive care may include replacing fluids and electrolytes, maintaining oxygen levels and blood pressure, managing fever, pain, vomiting, and diarrhea, and treating additional infections or complications. The earlier appropriate medical care begins, the better. Suspected Ebola should never be managed at home without guidance from public health and medical professionals. Yes? Breaking the chain of transmission is one of the most powerful ways to control Ebola. Avoid direct contact with the blood and body fluids of someone suspected of having the disease. Healthcare workers require appropriate personal protective equipment and strict infection control procedures. Good hand hygiene is essential. During outbreaks, people should also avoid handling sick or dead wildlife that could potentially carry infection. Safe burial practices are particularly important. The body of someone who has died from Ebola can remain infectious. Traditional funeral practices involving direct touching or washing of the body can therefore create a serious transmission risk during an outbreak. Public health teams work with families to provide burials that are both safe and dignified. Contact tracing is another powerful defense. When someone is diagnosed, health teams identify people who may have had risky contact with that individual. Those contacts can then be monitored for symptoms. This allows potential cases to be detected quickly and helps stop transmission. Yes, vaccines have changed the fight against Ebola. A licensed vaccine called Ervebo protects against Ebola virus disease caused by Ebola virus. During outbreaks, health authorities may use a strategy called ring vaccination. People who have been in contact with an infected individual, and sometimes contacts of those contacts, can be offered vaccination when appropriate. But remember, Ebola can be caused by different viruses. A vaccine effective against one does not automatically protect against every ortho-Ebola virus. Here's an important distinction. Ebola isn't like type 2 diabetes or cardiovascular disease, where lifestyle can strongly influence whether disease develops. You don't develop Ebola because you eat too much sugar, don't exercise enough, or are overweight. You must be exposed to the virus. Therefore, exposure is the primary risk factor, not lifestyle. Poor nutrition, dehydration, or serious underlying illness may reduce a person's ability to cope with severe infection, but they do not create Ebola infection. Certain behaviors can increase exposure risk, however. These include handling an infected person without adequate protection, touching a body during an unsafe funeral, or handling potentially infected wildlife. No food, vitamin, herb, or supplement has been proven to prevent Ebola following exposure. Good nutrition supports normal immune function and general health. But garlic, vitamin supplements, herbal mixtures, and so-called immune-boosting remedies cannot replace vaccination, infection control measures, or professional medical treatment. If you've been in an Ebola outbreak area and believe you've had contact with an infected person or contaminated body fluids, contact the appropriate health or medical authorities immediately. Potentially exposed individuals may need monitoring for 21 days. If symptoms develop following a credible exposure, urgent medical assessment is essential.
Call ahead and explain your possible exposure, rather than simply arriving unannounced at a crowded healthcare facility.
Finally, remember these 5 facts. Ebola doesn't normally spread through the air like influenza. Not everyone with Ebola develops dramatic bleeding. Ebola infection isn't automatically fatal. Healthy eating alone cannot prevent Ebola, and it is no longer accurate to say that nothing can be done for Ebola patients. Modern supportive care and specific treatments for certain forms of Ebola disease can save lives. Ebola is an extremely serious infectious disease, but knowledge is one of our strongest defenses. Remember, recognize the risk, avoid exposure, follow public health guidance, and seek medical help immediately following a credible exposure or concerning symptoms. Fear spreads misinformation. Accurate information helps stop disease. If you found this video useful, like, share, and subscribe for more evidence-based videos about health, nutrition, disease prevention, and healthy aging. Because understanding your health is one of the most powerful steps you can take towards protecting it.